ADHD. It's a chronic condition that has to do with I'm going to do this in a different color. Attention difficulty. Also hyperactivity and impulsiveness. I spelled that wrong. Okay. So, ADHD is very common. It has about 3 million U.S. cases. Not million U.S. cases per year, which is a lot, like, compared to some disorders or disabilities. So, ADHD, it's a chronic disorder. And really quick, I'm just gonna tell you that it can't be cured, but treatment helps a lot. So, it's a chronic disorder. It's a chronic disorder, like I was saying. Sorry about the terrible handwriting. Which means that it often begins in childhood. That's a kid. That's an adult. So it usually is this long. It could be from 6 to 8 years, which is not, it's pretty long, but it's not as long as some people who have it lifelong. So from a kid to an adult, lifelong, to an elderly person. Which, I'm not going to scare you because my drawings stink, but that's an elderly person. If my drawings scare you, you can skip ahead. I won't blame you. It often begins in childhood, goes to adulthood, and yeah, you have it throughout the whole time you live. A symptom chart. So some of the symptoms in ADHD include behavioral, cognitive, mood, and then there's the also common column. So in behavioral, there's aggression. So if someone doesn't do what they want, they might get aggressive. It's not very good. Excitement, which you would get overly excited if someone or something that you like does something. Fidgeting, which would be, fidgeting. Hyperactivity, being hyper. Impulsivity, repetitive words and actions. I'm pretty sure you know what those mean. Cognitive, so there's difficulty focusing, which goes along with short attention span and problem paying attention. That usually is what schoolwork gets affected with. Forgetfulness, it's not like long term, like you don't know whose name is whose and all that stuff. It's just kind of like if I tell them to go eat breakfast or something, they'll probably forget and do something else. There's anger. For mood, there's anger, anxiety, boredom, excitement, and then there's mood swings. So mood swings are not this. That's not mood. That's mood, actually. That's not mood swings. And that's a swing, just in case you can't tell. And mood swings are like if you're happy and then you suddenly become angry, and then for no apparent reason, and then you just become happy again. That is a mood swing. So also common is depression and learning disability. That is like depression and learning disability. That's kind of self-explanatory. You can have a learning disability and ADHD together. It's not common, but it's possible. Treatments. So there are treatments. There's medications. Sorry about my terrible drawings. So one of the medications, there's plenty, but one of them is stimulant. And look, it fits. And it basically adds, I guess, increases the neurotransmissions. Heart rate and blood pressure, which is BP. It increases those. But it also decreases appetite and sleep. So you can also take therapies. There is therapies available. So there is there's talking therapies that counseling kind of. And so talk about how you feel, blah, blah, blah. Talking about whatever. Then there's also family therapies, which has to do with one person, which is like the therapist, talking about trying to get everyone in the family together just because there's someone who has ADHD. There's also specialists. Now specialists can do a lot. They're like your doctors if you got hurt or got sick or whatever. But there's certain specialists, and I'm just going to give you two because there's a bunch. There's psychiatrists, and there's pediatricians. So pediatricians are actually they're like doctors for kids, and they're for basically everything. Like when you go to the doctor's office and you've got like a bad flu or whatever, after the nurse, the doctor will come. The doctor is the pediatrician. Pediatricians help in autism and ADHD. Psychiatrists are special doctors in like whatever field that you want. This is a picture. It has like the normal, I'm not going to say normal, ADHD, non-ADHD subject, and this is the ADHD subject. So I just want you to like look at the difference, like the shape too. it actually makes a difference. It's not like it's a completely different brain. It's the same brain. It's just one with non-ADHD and one with ADHD. I like just look at the difference and see how the two brains are similar and different. So I run the medical channel for kids, and I make videos about the brain, the human body in general, and I also make videos about the heart and heart problems and heart diseases and just the heart, how it runs. So you can visit my channel at bit.ly/the-med-channel. That says a med channel. There. And that goes to my medical channel on YouTube. So thank you for watching.